show. Drug overdoses kill more Americans than car accidents, and many public health officials are now saying drug abuse has reached epidemic proportions. After the death of actors Philip Seymour Hoffman and Corey Monteith just a few months ago, many are beginning to realize that this drug does not discriminate. Here's more on that story.
Calls my friend.
There's only one thing I value in this world, and that's loyalty. Without it, you're nothing.
He was a really special human being, and he was one of the best actors to ever live, without a doubt. And anybody who worked with him felt that, and felt grateful for having a chance to work with him.
Do you think I took this job to spite you? I was writing the script as they were filming. All that time in Italy, and
He's young, you know, he's so young. You know, to die at any, I mean, he's young and he had kids. He had small kids, and you know, on the surface you'd think, here's a guy that's doing okay in life. You know, he doesn't have things that other people might have as a problem.
I just didn't think it was
No, it doesn't matter what you thought. It matters what you did. It matters what you didn't do.
And to talk more about treatment and the rise in heroin use, Dee Dee continues our discussions. We are also joined by Janine Kean, President and CEO of High Watch Recovery Center. Janine is an internationally recognized expert in the field of substance abuse, and actor James Lewis, who is also a screenwriter. So we thank you very much for joining us and talking about this, and just a very sad week to be talking about this. We just lost Corey Monteith also just a few months ago. Philip Seymour Hoffman was almost compared to Brando. And if you
I'd say there's a close comparison there, yeah.
If you can just talk to us about what made him so special as an actor, and then of course, Janine, we're going to be talking to you about substance abuse itself.
Well, historically, actors have to have easy access to their emotions. The director of Nebraska, Alexander Payne, said that sometimes it's difficult for actors to tamp down the emotions that non-actors experience. So, for example, we may have the disappointment of a death of a pet, for example,
sure, that
the rest of us can sort of shake it off and get on with our day. People that have such access to their emotions, it's an intense emotion for them, and they don't tamp down their emotions. Therefore, if they play a role where it's heavily laden, they come home and they've still got it going.
Okay, it's an interesting perspective. Thank you for sharing that with us. Dee Dee, this is the second time we've talked about this on the show. Obviously, just a few months ago with Corey Monteith, and now Hofmman.
Yeah, you know, hopefully people can learn from this, because I don't know why this seems so jarring. I think because he has 3 children and because the needle was still stuck in his arm. But like Corey Monteith, I thought it was wrong when he was honored at the award show, and I think that's probably what's going to happen with this actor. I don't think we make him a monster. We don't make him a martyr. I mean, I think we need to realize that heroin is a terrible drug. It was irresponsible. It was bad. He had all this heroin in his apartment. So, you know, everybody talked about how wonderful actor he was, and he was. But let's talk about what the problem is with heroin. It's a terrible problem in our country now, and I think we need to really try to look at it and figure out how do we try to stop this.
And it's interesting, we have a highway for our viewers that are overseas. There's a highway right near us, which is called Heroin Highway. Done a couple stories on that from New York City down into Pennsylvania. And Pennsylvania is one of the states that is seeing such a rise, but many states have. And Janine, if you could just talk to us about that.
Well, first of all, I'm not sure I agree with it about being about emotions. It's about brains. And I think that people really don't understand what this illness is. People are genetically loaded for addiction. And actually, the addictive brain forms in the first 3 years of life. And it forms in between the relationship of the primary caregiver and the individual. So you're set for addiction by 3 years old. As you get older, if you start taking substance, your body, your brain receives that substance far differently than people without addictive brains. And it becomes, the pleasure is very intense, it's very phenomenal, and you keep going back for more. And this is what we're not understanding in our society, and there's still the stigma. I think that they should be honored. I know, but I think they should be honored because people with this disease are warriors.
Warriors or worriers?
Warriors.
No, they're losers.
Warriors,
I mean, no,
too.
this guy had 3 kids. How terrible and irresponsible. He leaves these people, leaves his kids, leaves his family, and he knew better. Look, you can have an addiction, but you can get treated for it. He had plenty of money, plenty of resources. I think that's the problem, what you all are talking about whenever you make them these martyrs or these heroes. It's ridiculous.
We're not endorsing his behavior, we're endorsing his work on the stage in front of the camera.
That's different, but that's not what she's
no,
saying.
I'm not saying that.
She's not saying that.
He didn't have a choice to be an addict.
Yes, he did have a choice. Everyone has a choice.
I disagree with that. I completely disagree with that.
Carry on.
You don't know you're an addict when you're taking substance.
But he did know he was an addict because he said, "Hi, I'm Philip Seymour Hofmman.
Right.
I'm a heroin addict."
Right.
I mean, he said that a couple days ago. And in fact, as new reports are coming out, he thought that he was going to die.
I'm talking about 23, 24, when he started using substance, he just liked it differently than people with non-addictive disorders. And actually, this man was able to maintain sobriety for 23 years. But addiction is like diabetes, it's like heart disease, it's chronic illness. Chronic illness is marked by periods of remission and periods of exacerbation.
Okay. Now, to James, your point about how he was very emotional because he was an actor and played certain parts, could that spur a person to maybe want to relive that high, if you will, and then maybe start abusing again?
Well, it's not a high. Heroin is a low. I've never taken it, but from what I know about it, it's not like taking LSD or amphetamines.
Okay.
It calms you down again. And I think at the end of the day, if you don't have a happy home life, I've talked to actors who say, well, I played a heavy character, but fortunately I went home, I made dinner for the kids, I laughed, we had a good time. I never knew Mr. Hofmman, but from what I hear about him, he didn't really have a very happy home life. He came home from working on the theater or working on the stage, and he was probably still as wrought up as he was on stage. So what did you do to cool down?
But it still is amazing to me because, I mean, you may think of other drugs that Hollywood people that have access to money, they would be going towards a different drug. But they went to heroin, and heroin is now like $5 a bag, which is why a lot of these young kids are doing it. So how do we stop this? I mean, not just with Hollywood, but and why do you think Hollywood folks are even so leaning so heavily on heroin?
We have to start spending money on prevention and treatment of addiction. We're not. When you look at the money that's being spent for diabetes, for cancer, for even major depressive disorder, it is far greater than the amount of money that we're spending on addiction.
Well, they're talking about that with incarceration versus treatment plans.
It's
not putting necessarily drug addicts into prison.
And that's not worked. I mean, our country's in a worse position than it's ever been with drug addiction, and we've had a war on drugs. Putting them in prison isn't helping them feel better or get better. It's just caging them.
But James, why do you think, like again, when we go back to like the money, I mean, heroin's $5 a bag. I mean, you would think maybe they would be going towards more expensive drugs or something. It's just very surprising to see that heroin use is going across the board, the middle class, to Hollywood.
I didn't realize until I started reading up for what we're doing here and now. I didn't realize heroin was that cheap. I remember for all the magazine stories I read in the 60s and 70s that people were having to steal and burgle houses to pay for their heroin addiction. Apparently it's pretty cheap, and that makes it really dangerous.
But it's very potent. So if he really wanted a bang, that would do it instead of like marijuana, which would be lighter, and that's another issue that comes up. I mean, is that a gateway to heroin, or is marijuana a better option than heroin? So now that's a big conversation.
Well, marijuana is an entirely different kind of drug.
Yes, it is. However, a lot of people feel that is a gateway drug to drugs like heroin. So that's the conversation now.
Well, which is interesting to see Colorado and how that's playing out right now. Well, since you're the expert on substance abuse, can you address that?
Yes, I can. You don't start out using no substance and going to heroin. You start out usually smoking or drinking alcohol, and if they begin, and it's a disease of adolescence. They're starting young, using substance, and then you're right. It's a gateway drug is cannabis or inhalants, and then once the youngster does cannabis or inhalants, that gateways them into the harder core drugs, and then they'll start with the cocaine or the pills usually, and they can't afford that. So heroin is $5 to $10 a bag. That's the eventual outcome. By the time they're coming to me, they're IV heroin users, but they're 19, 20, 21 years old. They started when they were 10, 11, or 12, and they started with cigarettes.
Well, and not that, but in some ways, the death of this beloved actor is certainly going to bring a face to heroin addiction. So some good may come from his death. Do you agree with that, James?
Yes, and I would hope people turn to things like the 12-step programs. I've been to AA meetings with a friend of mine, and I've seen people there, they were really committed to getting over this thing that was killing them. I don't know whether that applies to heroin or not. I've never heard anybody talk about that. But I've seen it. 12-step, extremely effective with alcoholism.
How do you think he's going to be remembered?
As an outstanding actor.
And so much more that could have come. Dee Dee, your thoughts?
Well, you know, before, kind of hard on the guy, but I think that it's something that we all need to learn. And we all need to realize that heroin and drugs like that are very, very dangerous. So it's nice to talk about what a great actor is, but let's also talk about what a terrible problem. And I think it is irresponsible, but that's why it's good to have the conversation. So perhaps more money can be put into what you're talking about addictive substances. And I agree. We need to address that.
And I thought one of the sad commentaries was somebody had taken pictures and tweeted about him. He was on the airplane, and I wonder if that person now feels guilty that they did, take such, degrading pictures of him and post them, because he probably was really calling out for help at that point. When you see somebody really calling out for help, what is the first thing that somebody should do?
Get them into a treatment facility.
But that's easier said than done.
Actually, it is families or loved ones that get people into treatment. It is not the person with a substance abuse disorder that goes on their own and makes a phone call and said, I have a problem, let me get some help.
Or an arrest or something like that.
Right, something critical, whether it's a family or an event, gets someone into treatment. But in his case, he should have been in a treatment facility, and he probably wasn't in the treatment facility he was in long enough the year prior.
And James, I know obviously you're an actor, you didn't know him, but what were some of your favorite movies of his? And
Capote, there was a little clip of it you just ran. And the way he got that voice, that wasn't the way Phil Hofmman talked, but it's the way he took on Capote. It was like he channeled him. And that emotionally could be a dangerous thing to do, especially with a character like Capote, who was not that well put together anyway.
Well, you said some actors will go home and they can defuse, if you will, with family and things like that. But like when you go into acting school, what do they tell you to do?
They don't. But what I would tell you to do, you need to have some kind of spiritual foundation. Other than, some people get into acting as a form of religion. Afraid that doesn't work out too well.
Well, that might be a good commentary on Hollywood and drug use, that there should be some sort of not intervention, but some sort of trying to think of the word, education, I guess it would be, about how to channel those emotions. Agree or no?
I agree, absolutely, because you're opening up a box there, depending on the kind of character you're playing. It could be a kind grandfather, or it could be a serial killer. Whatever it is, if that's not you, you need to be able to connect, but more importantly, to disconnect.
That's interesting. Dee Dee?
Well, yeah, and it kind of reminds me of Michael Jackson, too. Remember how he died because they put him to sleep, basically. He didn't wake up again because he had to come down. He was dancing and rehearsing, and then he couldn't sleep. So it was the same thing. It was just too much. It was too much of a downer, and it killed him.
I would say you need a support system, and you probably know about this than I, that a family member, a loved one who says, look, you need to stop that.
But here's the problem with the actors and with people with a lot of money. The enablers will do whatever they want because they want their money. They want to get paid. I mean, and if they want their drugs and they're trying to take them away, they're going to get fired. So that's the tough part, whenever you're rich and famous.
And it's the family that actually feeds the disorder. Because the very things that the family's doing to try to control their loved one is actually enhancing the addiction.
Well, James Lewis, we thank you so much for being on the show and sharing your insights, and also Janine Kean, thank you so much for coming on.
My pleasure.
And keep it here to Fresh Outlook. There's some big changes coming to Microsoft, and get out the birthday candles because Facebook turned 10 this week. We'll be right back.